Welcome back. Local on 2 is celebrating Wellness Wednesdays and helping you feel better by addressing a variety of topics. When we think of hormone decline in women, we usually think of hot flashes in our 50s, but is that usually the case? Sylvia Castaneda wanted to learn more, so she sat down with doctors from Inspire Medical Wellness in Mount Juliet and Avexia's Health Solutions to get some insight on the subject.
As we women get older, we all experience hormone decline. But just how soon can this start? What about symptoms? There are so many questions, which is why I am always so happy to have back with us Dr. Jason Burchard, who is the owner of Inspire Medical Wellness in Mount Juliet, and Dr. Terri Denai, who is the founder of Avexia's Health Solutions. Welcome back to Local on 2.
Thank you. Thanks for having us back.
Okay, so let's talk about symptoms. What are the main symptoms that women complain about when their hormones are low?
Well, it starts a lot of times a lot earlier than what I think a lot of women realize. Yep. Meaning the symptoms typically start sometimes 15 to 20 years prior to quote unquote menopause. We find that a lot of times around, sometimes even a little before, but around the age of 30. Mm-hmm. A lot of women, and there are several variables that will kind of determine this, but you can almost expect around age 30 that testosterone is going to be a hormone that you're going to start to see a decline in production with women. Then a few years later, as she gets closer into perimenopause, sometimes again, this can be her mid even to late 30s, progesterone is a hormone again that you'll start to see some drop in. And then of course, eventually you get into some estrogen deficiency as well. The symptoms that they're going to present with mostly are going to be fatigue, the ones we hear the most about. They're fatigue. I'm just so tired. No matter what I do or how much sleep I get, I still am tired. And that may be part of it. They're not sleeping as well. And then, of course, another big one's weight gain. No matter what I do, what used to work, as far as my diet and exercise, it just does not yield the same result. Yeah. And this is where we get so much into understanding how hormones, again, dictate metabolic function.
Yep. Makes sense. So, Dr. Denai, talk to us about the tangible benefits of optimized hormones, mm-hmm. and maybe some of the things that we can't see or feel, but we know are happening.
Yeah, and I love that you used the word optimized because, as we've said on prior segments, we have patients that come in and say, well, I had my hormones checked and everything is normal. Well, there's normal for your age, but that doesn't necessarily mean optimal. And when we're talking about depression, moodiness, anxiety, irritability, difficulty sleeping, difficulty staying asleep through the night. Those are all the symptoms that start initially in our 30s and on into our 40s. It just gets worse as progesterone declines, like you said, because progesterone is a calming hormone, so the anxiety kind of ramps up. And so, really addressing those symptoms at the root cause, and that's the biggest thing, is dispelling these myths with patients that you're not deficient in Prozac, you're not deficient in Xanax, right? You're not deficient in a lot of these Band-Aid medications that we tend to see patients get put on. Let's get to the root cause, and that's the biggest thing we're really passionate about.
Dr. Burchard, I'm going to go back to you because you mentioned that for some women, the hormone issues, challenges can start in their 30s. Sure. But could there be other things that are going on that are coupled with that? Can you do a little more deep dive?
Sure, absolutely. Outside of, again, age, which can somewhat be predictable, there's a lot of what we refer to as really kind of endocrine disruptors, mm-hmm. meaning, again, our diet plays a big role in this, environmental toxins, stress, for women, obviously, having babies, pregnancies. Mm-hmm. These are all variables that can will, again, dictate ultimately some of the hormone production.
Dr. Denai, then let me move forward with this. What do you feel, with your expertise, are the main hormones or other factors that should be focused on when women are evaluated for these hormone deficiencies?
Yeah, I love that question. Obviously, the deficiencies and then optimizing those, but also you have to pay attention to gut health. How are those hormones being metabolized in the body? Are there other deficiencies like vitamin D, B vitamins, other things that activate our hormone receptors? I tell people all the time, I can put gas in the tank, but if it can't get in the engine, aka the cell, to do the work, then it's going to feel like you didn't really have much done. So a lot of clinicians and patients don't understand that it's not just a matter of going and get a prescription for a cream or a patch or a pellet or whatever. You have to really look at it a little more holistically and going, okay, I'm going to put this fuel in the tank, but what's your engine doing with this fuel to help you get the symptom relief you're seeking? It's really important.
It makes so much sense, and I so value and appreciate every time you come on the show to educate us about this, because we learn so much. So thank you so much for being here on Local on 2 today.
Thanks for having us.
Thanks again.
I'm going to send it back to you.
Thank you, Sylvia. To learn more about hormone replacement therapy or to make an appointment, visit inspiremedicalsolutions.com, or you can visit avexias.com and then click on Find a Provider.